So I'd thank you so much for coming and
Thank you
having a
too.
chat with us today.
That's all right.
This is Dave. Would you like to introduce
Introduce
yourself
myself.
and just give us a little bit of
A background.
background
Yeah.
as to who you are?
Yeah, okay. So my name's Dave Barker. I'm a consultant psychiatrist, also one of the academic secretaries or co-training directors for the Southwest Division of the Royal College of Psychiatrists. I was formerly a director of medical education for one of the biggest healthcare organisations in the country. In terms of my interests, my background, my specialist registration is actually in forensic psychiatry, but I'm a general psychiatrist and I specialise in addictions and neurodiversity as well. In terms of my academic interest, I'm more of an academic, to be honest, than a clinician in terms of where my bent is. So I've got a master's in philosophy from the University of Bristol, also a master's in anthropology from the UCL, and I'm currently doing a PhD in philosophy, which is the real reason why I went into psychiatry in the first place. And actually, that's the reason why I went into medical school, because I wanted to go to psychiatry, not because I wanted to be a proper doctor, as it were. So that's that. So that's my background. So I'm always coming from a sort of systemic, holistic perspective, and always trying to read between the lines and never necessarily take things that come to me at face value. And always, whenever I see a particular case, I'm always trying to look at their social cultural context. And that's critical when you are looking at reasons why someone's journey has ended up with addiction. So that's who I am. So in a nutshell, there's probably one or two other things, but that's sort of in a nutshell.
Okay.
Yeah.
That's kind of enough, I think.
I think so,
Personally, I thought we were going to take up half an hour with all of your qualifications.
All right, no, that's okay.
So why psychiatry?
Yeah, because the philosophy of the mind, really, and also I do have. I am a humanitarian in some ways, even though I'm quite academic. I am a humanitarian, and I do believe that there's something very wrong is going on in. I'm going to use the term Western society because I live in Western society. I do know about traditional societies to an extent because my parents come from that. But there's something very wrong that's going on, and I'm just trying to figure out really what's happening and how much does our minds get involved in all this. So yeah, that's why I did psychiatry. To be honest, being a doctor is also something that's meaningful as well. So a combination of all these things are the reasons why psychiatry. But and the reason why I did forensic psychiatry, because they use the term morbid curiosity.
Yeah.
Yeah. Because I'm very analytical as well, so I do like to figure out why people do some heinous things. So that's the reason I went into that specialty.
So forensic psychiatry is
Is the interface between the law and psychiatry. Right. So it's dealing with mental disordered offenders, essentially. But you may have to do court reports, sort of have a decision on disposal, whether someone goes to prison or should be treated in hospital. And then you become an expert in treating very complex, difficult cases that require aggressive psychotics or things, and that require security. And you become an expert at risk assessment as well as understanding how the law interfaces with psychiatry. So yeah.
And you're also a specialist in addiction.
Yeah, that's my special interest. And the reason why is because that comes from my understanding of society, really, and culture. Because I'm convinced that addiction, whilst there is probably some biological substrate to it, we know that. We know some people are more likely to get addicted to others. But why is there so much addiction going on now? What is going on? And why is addiction not just about substances, drugs? It's also about other things, other lifestyles, like, I don't know, the use of social media, shopping, things like that. What is really going on there? And therefore we're asking ourselves, what do we really mean by addiction? Are we saying habit? Are we saying kind of meeting an unfulfilled need? What are we really meaning by this? So that's the question.
Okay. So what we were wanting to discuss a little bit today was the relationship with family.
Yeah.
I get so many calls from family members who are desperate beside themselves, just don't know what to do and how to help, and they feel like they've actually tried everything, and why is their child, their husband, their wife, relying on a substance, be it alcohol, be it cocaine, whatever it might be. So there's substances for the moment rather than behaviours.
Yeah.
And you know, and from their perspective, it feels like they've done everything to support. They've done, you know, a good education, all these kinds of things. You know, from their perspective, seems like a very holistic kind of upbringing, if you like, for a child. Why is this happening?
Why
And
is-
the feeling of responsibility
Yeah.
for that.
So obviously, my work with Gladstones, I see all sorts of reasons of why someone may end up being addicted to something, and a variety of family dynamics, from those family who may well be very concerned and over-involved to those who are doing the right things, essentially, but still can't really reconcile what's happened to their son or daughter, to those who were just not there, the family weren't present, which is, I get all that. There's going to be a wide range. What I'm noticing, if we look at those families who seem to be doing the right thing, and that's fine, they're doing the right, and they probably are doing the right thing, but what they're struggling with is understanding that society doesn't seem to be as interconnected, really, because it doesn't matter how much you can look after someone. Your son and daughter still has to go out there in the wide world, and the influences outside of family now seem to be so powerful that it doesn't matter what the family does, and it doesn't matter how much love that family has given them during their formative years. They're still doing all the wrong things that they shouldn't be doing. So that begs the question: what is it in society or in the culture that's actually being so influential to someone who's been brought up in the right way? Let's say the right way. So what are we saying now, that the family, however good they are, may just don't have the same influence that they used to? Could that be the potential? Because that's almost a logical way of looking at it.
Yeah.
It doesn't matter how good the family is, and all doing all the right things, and providing all the material goods and all the love as well as that, but still the son and daughter ends up being an addict for some reason.
But it's a difficult thing, isn't it? Because, you know, I quite often speak to people, and it's from my personal experience. You know, my mother would just say to me, "Tiffany, you've got everything going for you. Why are you doing this? What are you doing?"
Yeah.
You know, I don't understand. You know, and I push back and push back and push back because she didn't understand, but I didn't really understand either. I was just, you know, in a mess. You know, but she, for example, left her door open to me at all times.
Yeah.
You know, was not boundaried, you know, in any way.
So the question we now, because this goes back to what I'm saying before, right? I mean, I don't like to use the term of family authority, because that suggests, you know, you perhaps being overly boundaried and you can get the opposite effect. But is it influence? A family just don't seem to have the same influence as they did, say, 50 years ago. Is that what we're saying? Are there more access to things that people can get addicted to? You know, whether we can talk about substances, but social media didn't exist 50 years ago, for example. You know, what is it? Or are people? Is it the way that we are? That we require something. It's almost like we can't wait for things. We can't reflect on things anymore, potentially. That we just need something now. A culture of that. Because, you know, when you look at social media, for example, you know, adverts are flying at you. You know, you watch the television, everything's flying at you. Everything, you know, you get notifications on your mobile phone every 5 seconds. Everyone wants something now. And so equally, maybe they want excitement now. They want to feel good now. You know, maybe that's in combination with the fact that people don't seem to have that much purpose. I don't know. Maybe they do, but maybe they don't. You know, maybe people are so wrapped up with technology they don't understand actually that human connection is really important. That technology is not God, for example.
Yeah.
Maybe people are putting on the high altar the fact that they've got their mobile phones. The mobile phone seems to be God.
I'm not even sure it's real connection in the slightest.
Well, this is his issue, because social media, it almost seems to be like a virtual world. Are people really connecting with each other? And so you have to ask yourself the question: if people aren't really connecting with each other in a Western technological society, right, then all those sort of things that make you feel good about yourself, good food, good social relations, the sun on your back, people don't really want that anymore. But people want something that actually isn't giving them those sort of things, and so they're just taking drugs, maybe, because and so that you can make it the argument, is that a form of nihilism? Are they just nihilistic? So when you're feeling nihilistic, then you can almost go, what Thanatos is the concept of death wish. Sometimes I see patients and they tell me that. So clients, they say, look, you know, I haven't got a clue what I'm doing now. I'm just taking lots of drugs. I don't really care anymore because I don't seem to have any purpose anyway. And that's a death wish.
Yeah.
They're literally taking substances to death.
I think that when you're taking substances, you also do get to that point. of
Yes.
what's the point? I won't be able to do this.
Because everything's
I won't
falling
be able to
apart.
live without it.
Yeah, that's right. Because you have, exactly, that's right. And also everything starts to fall apart. Your social, you upset your family, you lose your job, you get done for drink driving, and then you think, I'm going down.
And you end up isolated completely.
Yes, you do. You end up isolated. We see that all the time, don't we? Yeah, absolutely. So there's a lot of factors here in play. And you mentioned the family. Family, I think, is essential, but I was asking the question, what is family nowadays? Is it the gang? Is it the family? Is it the society? What is family now?
I suppose, you mentioned gang, there's so much of that going on nowadays. And it's when I believe, I don't know this to be the case, but I believe it's when you haven't got a connection with your family, you seek a connection elsewhere.
Absolutely.
And it is from people who you think are going to protect you, maybe.
Absolutely.
Nurture you in some way.
That's right. And maybe some families think they're doing the right thing, but they're not. Maybe they think they're doing the right thing because they're providing all the material comforts, but actually they're not there.
Yeah.
So they're emotional. Exactly. The emotional presence is there, which is what children really want.
Yeah.
Do you see? And that could be some sort of conflict there that's going on. And so the argument could be maybe families are just thinking they're doing the right thing. But then you don't necessarily blame the families, because again, they're not living in a vacuum. It could be a societal expectation that this is the way you bring up your child, by providing all the material things, but without forgetting actually it's the emotional kind of environment, or safety, all those sort of things from an emotional perspective is probably what's more important.
But what do you do as a parent when you see, what do you do as a wife when you see your husband? We have a lot of instances, and I think purpose has a great deal to do with it. A lot of instances of people who've done very well, been very successful, been heavy drinkers for the majority of their lives, retire, all bets are off.
Yeah.
The drinking has got excessive.
That's right.
Only sits on the sofa watching the racing.
The meaning is gone. It has. We see that all the time. But you can make the argument is, had they ever known their meaning? Because for years they just had this structure, this job, which they thought gave them purpose, and then but actually, was it really giving them purpose? Because if you have a life where, what we call a rich life, where it's not just about your work, going back and forth, earning material things and all the rest of it, it's also about all the sort of deeper meaning stuff. You never really cultivated that in the first place. So when you lose your job, you've not got anything to fall back on. Why didn't you try to learn to play that guitar, or learn French, or whatever it was? If you leave, I personally think if you don't have to go into the humdrum of work, and you have time and you have enough money you've got time now to travel. You've got time to learn a musical instrument, all the things you really wanted to do. But people forget that, and so sometimes they retire and they think, what do I do now?
Yeah.
But you should have worked that out in the first place.
I think it's a difficult time. I do think it's a difficult time, and suddenly your husband's back in the family home as well.
Yeah, that's right.
For a child, for a mum, dad, looking at a child who is, who has become addicted to a substance, some horrendous substances nowadays for the younger children as well.
Absolutely.
Really, really damaging substances, and you just don't know what to do.
You don't know what to do, and you don't know what to do because the reason why you don't want to know what to do, because in a sense you're shocked. You're thinking, hang on a minute, I did what I was supposed to do.
Yeah.
But I still got addicted. So it's about reconciling that it wasn't just about you. It's about there's something wrong with the society that we're living. Something is going on. And there's lots of theories about what's going on, but something is going on. And that could be one way of trying to reconcile yourself and work with is to realize, because as soon as you start blaming yourself for something, you could start projecting that out and say, you might end up blaming professions that are trying to help your son. You might end up blaming your son, your daughter, and that's can be quite toxic.
Yeah.
The important thing is to say, look, okay, now how do we deal with this now? Not saying it's anyone's fault. Do you see what I mean by that?
Absolutely.
Yeah.
Absolutely. And how does one deal with it? Is it a case of let you reach out for some professional help?
Yeah,
it's difficult.
It's very difficult. I mean, I think you need skilled professionals to try and teach it. I mean, with people talk about family therapy, it's interesting because family therapy is a really important skill to have, and family therapists actually have a different training, completely different training to other therapists, and there just aren't enough around because it's a very difficult skill. And I'm not saying that's the way to fix it. That's just something you can engage in. But it's interesting. There used to be a lot more. There's much more of a concept of family therapy, even not just in addiction, but also in people with serious mental illness. Just services just aren't out there anymore.
Yeah.
Because they can teach you principles, because they have a very systemic approach, family therapists, which is kind of one of my philosophies, really, that you have to look at all the factors, you see what I mean by, to try to understand someone. So yeah, I'm not sure what can be done. I actually think you need policymakers, to be honest. I think you need to, I think the Western society needs to do something about itself.
It does.
I don't think you can get a bunch of professionals to do everything. It's not enough of us anyway.
Yeah. And I think, I think when I speak to family members all the time, and a lot of it is, what have I done wrong?
Yeah, that's right.
And I was saying this earlier, there's two ways of approaching it. One is, they tiptoe and walk on eggshells because they don't want to poke the bear, and it's just going to be horrendous.
That's right.
If they get the reaction, which a lot of people will react when they're under the influence of alcohol,
absolutely,
whatever it might be. But so you end up kind of living in an environment that is
that's right.
Impossible.
It is impossible because it's very fraught, isn't it? It's a loaded situation now. What do I do? Very, very. It's really difficult.
And then there is no communication. Really.
And that's right. Exactly.
Yeah.
So
you're either going to get into a fight with somebody, or you're going to just not say anything. Because you don't want to get into the fight. And the other way, of course, that families deal with it is to put their foot down.
That's right.
But unfortunately, the person who is in that addiction is not really responsive to either of those approaches. It is about them getting it themselves. And for a family member who is not an addict or an alcoholic, it's impossible to understand
that, to bridge that gap. That's very true.
Yeah. And nor should they understand.
No, that's right. That's right. It's very difficult. It's one of the big questions in Western society. The concept of addictions and how you link with family to support.
Yeah. Do you think the addiction has got worse as society's changed?
Yeah, it has. I think it has. Because I've been in psychiatry for 30 years and I've seen it. I think it's much worse. And not just about the access to different types of substances. It's not that. It's just the way people are. There's just a need for something now. They want it now. Whether it's a change of consciousness somehow, because this consciousness it's just not doing it for them. There's no meaning. That's why I always go back to the concept of nihilism, which suggests something existential is going on. Something is going on. I'm not going to pretend to know what it is, but I know something is going on. This is what I mean, because I've seen it just as a clinician. I've seen it. Yeah. So it's a big question. It's a very difficult question. I guess all Gladstones can do is just do the right thing. He can't pretend to change the world, but he can just do the right thing and have some sort of an understanding.
Well, the change starts in somebody, in each individual, doesn't it?
It does, and it has to. And if you can,
we could go out and fix.
Yeah.
Social media, I really wish we could fix. Yeah. But it has to. It comes from that one, taking that one step into I need to change, and I'm going to.
I guess
try.
Exactly. I think Gladstone's role really is to kind of trigger that spark, really. And then hope to kind of give the right advice when people move from the unit.
Because we talk a lot in Gladstones. We do a lot of work around emotional regulation.
Yes, absolutely.
And learning how to manage those emotions, because we want to change the way we feel. That's why we why we use substances. Why we have addictive behaviours. Why we overly use the gym. Why we eat too much.
Exactly.
Restrict our eating, whatever it might be.
It is.
Is that instant? I want to change the way I feel.
I want to change the way. So why is everyone having to regulate their emotions? That's the other question you have to ask.
Yeah. Because it's just so rapid, that constant need for entertainment.
That exactly, rather than just sitting on the beach and just relaxing, or just having a chat with a best mate, sitting down. I have
lots of conversations about because we don't allow mobile phones in the clinic.
Absolutely.
Can't possibly be without my mobile phone.
I know. It's almost as if they feel their right arm's been taken off.
Yeah.
They get really upset about it.
It's not helping you with your alcoholism.
No.
So why don't we just have a look at
Let's just have a look at the alcoholism. Yeah, absolutely right. No, but the emotional regulation is a big one. We know there's a lot of neurodiverse people out there that struggle with regulating their emotions. We know a lot of people have undergone complex trauma or whatever, and that can have problems with emotional regulation. And then there's a society that has expectations of you or not. And that has, there's all sorts of reasons why people... I see more people with problems with their regulating their emotions than I did 30 years ago. I see much more of it. You know, I'm talking as a clinician, not just in my general life. I see much more of it. So again, why is Western society creating people that just can't regulate their emotions? I'm not blaming Western society. I'm not saying it's just Western society. I don't know. It could be
society.
It could be, or I mean, culturally, I don't know what's going on in that. Really, I can't pretend to know now because societies are cultures are so dynamic. But something is going on in the West. Westernized societies, not necessarily in the West, because we're talking about Australia, New Zealand, and westernized. Something is happening, and that is the big question. And so, therefore, I think your question about family is really a question about society. Going back to that,
yeah,
and that's what we need to understand.
But again, the change comes from that one person, doesn't it?
Ultimately, the change comes from the individual, but we're interconnected. That's the question. We're not a bunch of individuals surrounding, completely disconnected from them. We're not really. We are interconnected, even though.
I mean, a big thing that happens at Gladstones as well is that sense of community.
Yeah, you're creating something that we had a little bit more 40 years ago.
Yeah,
we had that. More of it.
Being comfortable in that culture. Yeah. So if people come in and they don't know anybody and they're terrified because it's a massive step to do, the community who's already in treatment kind of gather them up and show them the way and say it's going to be okay.
So we use the term psychological safety, don't we, which is a buzz term. But yeah, it's about you're now creating a community. So is the question that we're talking about. Because you are talking about individual, and you're right in a sense, but is there a community now?
Yeah. There can be.
Oh, there should be. And we know there can be. But is there?
Well, I think, again, one of the things about addiction is that we step away from everything. We isolate ourselves and we feel so alone and we don't feel part of anything, even our family.
Yeah, that's right. Once the addiction has kicked in, with behaviours. But actually, does everybody feel connected as they should do?
Perhaps not.
Yeah, that could be the question. And so you might as well go down the road of just taking something. So there's so many questions here. In fact, it's interesting. This conversation has just raised more questions, to be honest.
Always do.
Which is good.
Yeah,
that's a good thing, because now we're kind of looking at things we're analysing things. We're kind of like, we're not just trying to come to a quick decision about something, because quick decisions are never the right decisions. It's like get rich quick schemes, isn't it?
Yeah.
If it's too good to be true, then it probably isn't.
It probably isn't true, is it?
Yeah.
So for a family, as we're on that, obviously it turns to fear, that need to help, not being able to help, actually then turns to fear. What would you, how would you speak to a family about that? Would you just say, look, this is outside your remit, you can't help?
Well, what you can do, you could talk about the concept of support, that that we're here to kind of, as an organisation or as a therapy space, whatever it is, to support you and try to understand how you're feeling. But we'll take a lot of the burden off you in doing what we're doing, to try and help you kind of reconnect when your son or daughter are in a better place.
Yeah. And we do family therapy at Gladstones, and we invite the families in for a session at a time.
Yeah.
When their loved one has done some treatment, quite a lot of treatment, is able to emotionally connect again with the impact that actually this has had on the family.
Some families need different things, Some just need acknowledgement, some need more reassurance, some need... But families can be extremely difficult, because there's a dynamic with families. With an individual, it can be even though you can't take the individual away from their context, there is still an individual. The dynamic isn't so complex, but with family, it's incredibly complex, and that's why it's difficult. That's why, as a Gladstone, there's only so much an addiction centre can do for that. And to be honest, the best thing to do is just to try to do the right thing in what you can do, and there's nothing, you can't do more than that.
Yeah.
You really can't. There's no point trying, because then you might make things worse. It's like running in quicksand. The more you try, the worse it gets.
Yeah. When is trying too much? When is it?
It can be too much.
You'll put everything into it, wouldn't you?
Well, you just end up resenting it, because you're not going to get anywhere. You kind of like, it's like the law of diminishing returns. You just do so much. If you do more than that, then it gets worse. That's what I've noticed, actually. Sometimes if professionals get over-involved in cases, it makes it worse. It doesn't make it any better. Because then you raise expectations, and then you can't meet those expectations, and then it all falls apart. So I see that all the time. So just do what you can do.
And ultimately, it's down to the person who has the problem.
And that's that exactly, and then you make that clear. Because in the end, you go home, and then you get on with your life. But that person still has their problem, because you're not their friend. You're not their friend. You can exercise positive regard, but you're not their friend. The concept of, we don't even know what a concept of friend is. A friend is someone who's there when you're sick in bed or if you need. But you're not their friend. You're a professional. You're just doing the right thing for them, but you're not their friend.
Yeah.
That's not. That's a disaster. Because then they have expectations of you, which you can't meet because you're not their friend.